Now everybody has permission to record. We will be recording here as well. So should anyone have a problem with their recording, we should be able to provide a backup to you. Thanks again, everyone, for taking the time. A very important announcement today. And again, thanks for joining us on such short notice. This is COVID-19 related. And here to give you the very latest on COVID-19 here in the islands is our state epidemiologist, Dr. Sarah Kemble. Dr. Kemble.
Thank you, Brooks. So I'm here to announce the Hawaii Department of Health has confirmed our first reported case infected with the Omicron variant strain of SARS-CoV-2 in an Oahu resident. On Monday, November 29th, DOH received notification from Diagnostic Laboratory Services of a specimen which showed a molecular clue that might point to Omicron. DLS immediately forwarded the specimen to the State Laboratories Division, and our laboratorians were able to start sequencing the specimen. We were able to use a new sequencing platform that returned results within days, even faster than we've been able to receive them in the past, making it possible for us to identify this as Omicron today. On the epi side, investigation of the case had begun when we first received the report of a positive COVID test before we were even aware of the molecular clue. So we were able to establish a few facts very quickly. The case was not vaccinated and had been previously infected with SARS-CoV-2 over a year ago. There was no travel history outside the state, signifying that community transmission of Omicron strain has already occurred in Hawaii. We are currently still investigating the case to identify contacts and provide appropriate quarantine guidance. So a few things for those of you who have been following the Omicron news, this may be familiar, but what are the reasons to be concerned about the strain? The variant was first identified in South Africa and brought to attention by South African scientists and epidemiologists because of a spike in cases they were seeing there, and then identifying this new strain through sequencing. Some of the concerns about this variant are that it could potentially break through vaccine and natural infection, higher natural infection. So there's still a lot to be learned about this variant, a lot of unknowns, but we are watching it closely. And of course, identifying our first case here in the state is something that we have a lot of attention on. Now, the bottom line in terms of public prevention measures, they are essentially unchanged. So while the variant is something we will definitely want to watch and track, we still anticipate that vaccination is going to be one of the best ways to slow transmission, whether it's getting the first dose or being boosted against COVID-19. And it's still going to be really important to wear your mask, practice mitigation strategies like maintaining distance as much as you can, and staying home when you're sick. And I will take questions. Thank you.
Dr. Kemble, this is Ben Gutierrez over at Hawaii News Now. There are a lot of unknowns, obviously, but, and I know the DOH is not the policy-making agency, but would there be any recommendations that could be made to policymakers considering the transmissibility that we know of right now of Omicron?
I'd say the main implications from a public health standpoint are we still really are in a place where we need to maintain caution, and that it's going to take layered strategies to combat this. So vaccine remains incredibly important. Boosters now more important than ever, and we do now have a recommendation that all adults 18 years and older should get their booster shot, regardless of your underlying conditions, regardless of your occupation. So if you have yet to get your first dose, go out and get it, don't wait. And if you have been fully vaccinated, now is a good time to go get boosted. Additionally, we're still going to have to be cautious. And many of the policies that are already in place, like indoor masking, are definitely ones that should be maintained during this time of uncertainty, as well as being cautious about social interactions, even though we have seen some reopening and cases currently remain low in the state. This is definitely cause for caution.
Was this expected or unexpected, considering that it's appeared in other states recently?
I would say I would have said that yes, I would expect ultimately Omicron to show up here. It was just a matter of when, because with each new variant, as we've seen, we are such a globalized world now. People travel to and fro, and this is a very infectious disease. So it was very likely that we would see spread. The idea is through the layered mitigation to slow down spread so that we don't see surges or spikes that can overwhelm our healthcare capacity.
Dr. Kemble, did you say what symptoms the person had?
This was a mild, in fact, mild to moderate symptoms, I would say, so not hospitalized, and still monitoring the condition of this case, of course, but it's a mild to moderate case at this point.
Are you able to provide like a age range? I know nationally we're seeing the younger people once again, as we did see with Delta, and obviously they don't get as sick as our elderly population does, but is there an age range on this particular case?
This is an adult resident under the age of 65.
Dr. Kemble, you mentioned that there's no travel history and that this is a community transmission. If so, would this then be the first local community transmission of Omicron in the US?
My understanding from the news announcements this morning is that Minnesota has also identified a case in a person who's a resident of Minnesota who had traveled to New York City and returned to the state, but had not traveled outside of the country. That person had apparently attended a convention, so there was an exposure where they might have come into contact with other travelers. In our case in Hawaii, we have not identified that connection to a traveler at this point.
And Dr. Kemble, are we using, is it called the S gene drop detecting kits? Is that what we're using to detect it earlier?
DLS was able to notify us because the PCR method that they use does detect an S dropout for this variant. So that was the signal, the molecular clue that allowed us to get a head start on this. But the confirmation of Omicron came from sequencing at our state laboratories division.
And how many are we sequencing now?
This is the only specimen at this point that's suspicious for Omicron that has been brought to our attention.
Dr. Kemble, is it possible that because this person did not travel, that there are more cases here in the state?
I would say it's likely that there are more cases in the state because we don't have that travel linkage. The implication is that there had been some transmission in the community before this came to our attention. Whether that was a single linkage back to a traveler or several degrees of separation, at this point we do not know that, and we may not have that information in there. But it does tell us that, okay, this is going to be something that we'll be watching now in the state, and we'll be following that in our variants report.
Once again, Dr. Kemble, I know that we don't know quite as much, but what do we know? What's the latest that we do know as far as severity and transmissibility of this particular variant?
What we're hearing from our colleagues in South Africa anecdotally is the epidemiologic situation. There was an outbreak, started with an outbreak on a university campus. Now that's relatively young, healthy people, but the people that were getting infected with Omicron there have mostly had milder symptoms, not very severe. It is too soon to say, though, whether that's what we're going to see in other scenarios or if that was specific to that outbreak. So as I said, still really a lot to be learned about this new variant.
Dr. Kemble, is this case here on Oahu or is it on one of the outer islands?
The case is on Oahu.
Can you tell us specifically, like, I guess, what town, what city on island?
At this point, for the confidentiality of the case, we're not disclosing additional location information.
Dr. Kemble, is this case in hospital right now? What is the disposition of this particular patient?
They are currently in isolation at home, so not hospitalized.
I know contact tracing is still underway, but do we have any indication of whether this person had attended any major type of events that we should be aware of, or any type
That's
of?
part of what we are actively investigating. So that investigation is still underway.
Okay, thanks. And just to clarify the timing, so this was there was initial testing or indications on Monday, but which day was it actually confirmed?
Today.
Today. Okay, got it. Thank you.
And just a note on that, in the past, we had typically a 7 to even 10-day turnaround on sequencing. So this is the fastest we've been able to get a result back in this period of time.
Can you talk about how concerned you are? I mean, this seems like this has been, getting a lot of headlines because of the, potential transmissibility. And how are you feeling about this, knowing that this is here?
It is our job in public health to be concerned about new variants and this type of emerging strain. That being said, there are a lot of unknowns here, so I don't want people to panic about this. I think it's cause for attention and concern, but the tools we have in our toolbox remain powerful tools to prevent transmission. But it does remind us we should be using them together. So to me, the main thing is this is a reminder: don't rely on your vaccination status alone. Don't rely on staying home when you're sick alone. You kind of have to put all those things together. Continue wearing your mask when you're in private spaces and in indoors public spaces. And I think that combination of things is what's going to continue to prevent spread and slow transmission. But certainly, as an epidemiologist, I'm very interested to see what happens now in South Africa. Are they going to continue to see this variant take over, or is this going to be more limited to one area or this outbreak? Those are the questions that are going through my mind. And how severe is it going to be? If it is equivalent to or milder than the other strains that we've had, this may be something that becomes part of what we've already been doing to deal with these COVID strains. If it is more severe, that could change the way we're looking at things.
Dr. Kemble, more broadly speaking, in terms of the pandemic, are there still any specific groups in Hawaii that you're particularly concerned about or focused on in terms of convincing them to vaccinate?
I'd say right now, getting children vaccinated is, of course, a big priority. That vaccine for age 5 to 11 is relatively new, and we're seeing strong uptake, but we'd like to continue to urge people to think of their family safety. Go get those vaccines now for all of your eligible family members. We've also, throughout the pandemic, placed a lot of attention on health equity and making sure that we're reaching communities where access may be more difficult, where there may be more misgivings about vaccine. And so education and outreach is really important. We want to, of course, make sure we're reaching our Native Hawaiian and Pacific Islander communities where we've seen a disproportionate burden, as well as some of our Asian ethnicities and Filipinos. So there are many groups that we definitely want to make sure we're addressing equitably.
Dr. Kemble, not to put too fine a point on this, but since this, at least at this point, the person does not have any travel, some people would definitely be asking, well, then how did it get here at this point? Basically people, I'm sure, are asking, and you're asking, I'm sure, how did it get here?
Yeah, my assumption is it did get here through travel, if not through this individual, then through some contact and contact of a contact. So somewhere along the chain, we had a traveler come here, presumably, who brought this strain in. That is how most of them, well, to my knowledge, all of the new strains that we've seen in Hawaii have come from outside. I'm not aware of any that originated here in the state.
Are you able to say if the person works in the hospitality industry by chance?
We're still investigating all of those details.
And then do you have an update on the current percentage of those who are eligible to get a booster shot? How many, or what is the percentage of those who have?
I'll have to check those numbers for you.
Got it.
Dr. Kemble, is the DOH actively testing or sequencing for this particular strain on Maui and other islands? And is it kind of just a matter of time, you think, before it spreads to other islands?
Yes, we are actively sequencing specimens from all islands for this strain. We have a system that's been in place now for the better part of the last year, where we select essentially a random sample from all of the islands, and we oversample the neighbor islands to make sure they're adequately represented. And we're running those every week to look for any new strains. For the last number of weeks, it's been a Delta predominantly, almost 100% of our specimens. So this is definitely a new finding for us, and we'll now be watching to see if it remains a blip or if we begin to see a higher proportion of cases related to Omicron. So the neighbor islands will definitely be part of that surveillance plan.
So
All right. Another question?
Oh, I do know that you said these are mild to moderate symptoms, but are you able to share with us what those are? Does that include a fever, any cough or congestion or body aches?
At least the initially reported symptoms were headache, body aches, and cough. So pretty classic for what we've seen with other strains of SARS-CoV-2.
Okay,
Just one
thank
more
you.
question. Sorry, you mentioned that almost 100% of the cases are the Delta variant. You also mentioned that this particular Omicron patient was unvaccinated. Just do what's the proportion right now of vaccinated versus unvaccinated who are currently infected?
As we've done in our recent breakthrough report, we've looked at both proportions of cases that are fully vaccinated and hospitalizations and deaths. And yeah, I don't have the exact numbers as of today, but what we've seen throughout as we look at those numbers is the vast majority of the cases are unvaccinated, and that has remained true throughout the Delta surge. I think that's one of the question marks about Omicron. So far, we have very small numbers in the United States. This would be the third case of which I'm aware as of today. And two of the other cases reported from California and Minnesota were in fully vaccinated individuals. So ours would be the first in an unvaccinated person with prior infection.
And do we know how many others, Dr. Kemble, do we know how many others close contacts are being tested at this point?
We're actively doing that outreach now to identify all of the close contacts and also testing, make sure that quarantine guidance is provided.
Okay, it seems Dr. Kemble has had the opportunity to field a bunch of your questions, very good questions. Thank you all very much for your quick attention and quick reporting of this matter. Obviously, an important development in the pandemic, and we really won't know how important until we learn more about the Omicron variant. Dr. Kemble, I'd like to thank you very much for your time. I'd like to thank all of you for taking time from in a very quick manner away from the other assignments you had today. So thank you for getting this information out to the public. Look, holiday season is upon us. It's a time for friends and family, and let's all take the measures that we can to protect one another, and especially the people we care about most during the holiday season. Not that we needed a wake-up call in this pandemic, but this news certainly serves as another reason to protect one another, get vaccinated, mask up, especially indoors, and distance and avoid crowds as best you can. Thank you, everybody. Yes, and someone is reminding me that look, if you think you've been exposed to someone who is positive, if you've got symptoms, please go to hawaiicovid19.com. You can find all the information on where you can get tested there. You can also find information, of course, on where you can get vaccinated. Vaccines are readily available, whether you are age 5 through 11, whether you are someone who's already got both shots and you're seeking a booster shot, or whether you are unvaccinated and you've decided that the Omicron variant is a good reason to get vaccinated. Please take advantage of this opportunity. We think we have a sufficient supply. to handle demand in all age categories, boosters included. So please, folks, take care during the holiday season. And I expect that we'll be talking to all of you very soon. But take care, and thanks again for your close attention to this matter. Aloha.